Welcome, everyone. I'm Dr. Veronica Zhao of Avid Sports Medicine, and we're really excited to bring you this month's partner talk with one of our favorite partners, Dr. Lauren Lowe. I'm going to let her start off talking about herself, but I just want to say that one of the reasons that we're doing this is that, we see injuries and pain and lots of things all day that aren't necessarily something you think about bringing in a psychologist for, but from all the experience, I guess it's been 14 years since I've been here in the Bay Area practicing, there is no way to separate mind, body, and recovery. And so that's why I have Dr. Lowe as one of our partners who we can collaborate on patients and just general ways to help people recover. And then the other reason is that, this should be part of every sports medicine office, I think, and every recovery plan. So I'm going to let her talk about herself. I'll just say that she's a licensed clinical psychologist and also a former Division I athlete. So I hope you give us a little background on that. And this session is not just for high level athletes. This is not something that it's only for LeBron James or something like this. Is any person who moves can use this information. So without further ado, Dr. Lowe.
Well, thank you so much for the warm welcome, Dr. Zhao. It's an honor to be here with the Avid Sports community. And like she said, I'm Dr. Lauren Lowe. I'm a licensed clinical and sports psychologist based here in the Bay Area. If you caught a little bit of our chit chat before we got going, I am a Bay Area native here, now living in the San Francisco area. And I'm also the CEO of a sports and performance private practice called Align Sports and Performance PC. And so what brought me to this field is exactly what Dr. Zhao shared, is that I have been a lifelong athlete. And so I know both personally and professionally what goes into competing, both as you're growing up, but also if you're one of those athletes that strives to reach higher levels, whether that's through collegiate sports, professional sports, or being that really, really high level weekend warrior, or the individual that just likes to go out with their friends on the weekend and, play some tennis or go for a run. And so, here in the Bay Area, especially, we have a culture around athletic and healthy living. And that's something that I love and what has driven me to specialize in this area. So just a little bit about how I got here. Like Dr. Zhao said, I was a Division I athlete in college. I played lacrosse. And so I also am an athlete who knows what it's like to go through injury. So for 6 years of my athletic career, I suffered with the consistent injury, recovery, rehabilitation, re-entry to sport, and then the ongoing process of dealing with the mind-body connection. And so I'm really honored today to be here because I specialize in injury recovery with athletes, because this is something that's really hard. No matter at what level you're competing or enjoying sport at, whenever we have an injury that threatens any part of our physical ability or our able-bodied privilege, it can be really detrimental, whether it's from your day-to-day living or just the withdrawal from sport. There can be a lot that can go on emotionally. And for those of us who have suffered injury or have the experience of recurrent injury or different flare-ups at different times, sports are wear and tear on the body, and the body's fallible. But one of the things that we are always in control of is our mind. And so being able to talk about the mind-body connection in relation to activity, recovery, and sport, I think is really important, because there are things that we can do during injury that can help us both mentally and physically to not only go through that journey, but to come back and re-enter into sport in a way that feels good to us. If you're injured and experiencing any type of ambivalence, worry, sadness, changes in your mood or behavior, not wanting to do as much or not feeling as motivated, you're not alone. So today's talk is to really educate and provide our community here with some tips and tricks of how to navigate this with the beautiful support of Dr. Zhao and our team at Avid Sports Medicine. And so my hope is that we can get into some of these questions, and I prepared a few slides for everyone just to help ground in case you are more visual than auditory. And then we'll go through these slides today, and I will leave a lot of time at the end in case anyone has any questions or things they'd like to ask. I'm always happy to be a resource. And if anything comes up during the presentation as well, feel free, you can raise your hand. I have no problem with answering questions as we go along. So feel free to chime in as you wish. I know we're on Zoom, so as much as we can make this interactive in whatever way feels good to the community, I'm happy to do so. So just shout a holler as we get going, and we'll roll on together.
Perfect. I have one question before we get into the meat. Did
Yeah.
you have access to someone like you in college when you were dealing with your recovery?
Great question. I did not. So one of the beauties of this moment in sports and sports medicine is that we're actually starting to talk about mental health and well-being. It's not something that we talked about, and I've been out of school for a while now, and so I definitely did not have that support or the attunement from my coaches or PTs or doctors to say, hey, you're really suffering, Lauren. Maybe, talking to someone about it would be helpful. And I'll be totally honest and transparent. My parents said, hey, do you think talking to someone would be helpful? And I had that mentality back in the day of like, no, I'm fine. Everything's fine. I can get through it. I'm strong. I'm tough. It's just an injury. And, so I learned firsthand what it's like to kind of struggle through. And while I had some resources, I definitely feel like more support would have been helpful in my career. And that's exactly a huge reason, again, of why I do what I do.
Yeah, that's really powerful to know that, you're kind of creating something that you wish you had had.
Yes, absolutely. It's hard. It's hard to be an athlete, and anyway. And the other part, too, that I think it's important for me to clarify is that both now and moving forward, when I say athlete, I'm talking about that identity piece. Okay. Because those of us who participate in sport at whatever level, like I keep saying, there's this drive, there's this part of us that likes the physical activity, that likes the community aspect, that has fun while doing it. And so, that's a big part of a lot of us. I identify as a lifelong athlete and always will, because it's not only what we do in this specific sport. A lot of times, this athletic identity is also how we live our lives. And so, there's just that piece too, that just as we move forward, remember that you're an athlete, no matter what you're doing, when you're doing it, how often you're doing it, it's something in you.
Sport of life. We're all in it.
Exactly.
So the first thing, and feel free anytime you want to share your slides, the
Oh,
first
sure.
thing
Pop them up.
I was hoping you would talk about is just what is the mind-body connection? We kind of use that term a lot. What does it really mean?
Awesome. So just to dive right in, so the mind-body connection is really taking a holistic model of how we actually operate in this world. And it's really this connection between our thoughts, our feelings, our behaviors, and how they actually have an impact on our physical health. So it's not uncommon for us to, let's say, feel stress. Okay. Then we start thinking about all the things that we have to do. All right. Then that might increase our level of stress. Okay. Then our behavior might become more frantic. We might be moving around or snapping at someone, doing things, right? Because they're not, we're stressed. And then at the end of the day, when we're stressed, what does our body do? It tightens, it's tense, our heart rate can increase. So it's really important to remember that everything, including our environment and the situation that we're involved in, has a direct impact and how we interact with our world and how our body feels from moment to moment. And I thought it was important to bring up, like I said, stress, because we live in a stressful world. Okay. I'm a systems kind of oriented psychologist. And so, in a way, when I talk about environment, I'm also talking about the world at large. And we have a lot of things going on in the United States and our world. And so it's not uncommon in these moments and others, along with just being an individual in society today, to have high levels of stress. Research is showing it. So, why am I spending some time on this? Is because there's a biological impact to stress. This is the exact mind body connection we're talking about. And I thought it was a helpful example when we're talking about injury and recovery. And so the reality is chronic stress increases cortisol levels. Okay. So, all right, that's our feeling, the stress. So now we're having the physiological body response, increasing muscle tension. It narrows our visual field. We get distracted. Our coordination is impacted. And so, if we're highly stressed as an athlete, then there's a higher risk of athletic injury. So, stress is common among athletes. In collegiate or high performing athletes, extremely high levels of stress. And so, when we have high levels of stress, the mind body connection is going to be impacted. And it actually increases our rate of potential injury for 2 to 5 times of our peer. And so this is just one example to really illustrate how, our thoughts, feelings, behaviors, and our body are all connected.
Love that. Just a question slash comment. I think I'm an anthropologist. That's why I studied in undergrad. And I love thinking about evolutionary theory. And I think that stress is the 4-letter word, and I don't know, it's actually not 4 letters, but you know what I mean? It's kind of a bad word.
Sure.
And we'll think about stress. It's like, it's all bad. It's all bad. But we would not be here if it wasn't for our biologic ability to react to stress. We would have been eaten, or something would have happened. So stress is actually not the enemy. It's that right now in our modern day world, our bodies are overreacting to you're treating the lion coming after you like the deadline you have at work, or like it's we have an increased heightened stress response. And I wonder if you could talk a little bit about how you frame stress for people, because then they get stressed out about being stressed out.
Totally. And just like anxiety, right? Stress breeds stress, anxiety brings anxiety, and it can be a really, self-fulfilling cycle that can elevate. And I thank you for bringing that up, Dr. Zhao, because I too love evolution theory, and I frequently use that example when talking about it. So when I talk about stress with individuals, I talk about it exactly as you did. This is actually something that's a natural biological response that is telling us something. And so in the world today, like you said, our trigger for stress is pretty reactive. There are lots of different inputs that can cause us stress, let alone with just the bombarding level of input of information and feedback that we get from the internet, social media, the news, all of these aspects. So I talk about stress as a necessary part of life. That stress is something that is normal. Everyone experiences it. But what I try to do is say, okay, well, all of us actually have an optimal zone of arousal for any type of strong emotion. Stress can be one of them. So when we look at our optimal zone of arousal, it's a bell-shaped curve that says, yes, a little bit of stress can actually increase our performance and drive and motivation. But when we get too far outside on the more extreme sides, it can be detrimental. So when we talk about stress, I really look at it as another emotion that we have to modulate. so that we can cope with this stress, that we have tools to deal with the stress. Because at the end of the day, we're all going to be stressed. But it's just, how do we deal with it? Do we know what to do about it? And are we self aware in the mind body connection to also be able to pick up on those physiological responses and say, oh, whoa, I need to breathe. I need to take a bath. I need to go for a walk. And so that's generally how I approach stress is we have it, it's going to exist. And so it's just about when does it get out of control for you and what can we do to exert control and alleviate it?
Great. We're on the same page then.
Absolutely.
Um, what are your top suggestions for people who their injury has taken them out of their sport? So a lot of people have a lot of their identity wrapped up in the things they do. Like I'm a runner, I'm a skier, I'm a cyclist, or I'm a hiker. This is what I do. This is like part of my social life. What do you do when you don't have that and you're struggling because that's your thing?
Great question. I mean, the reality is it's gonna be a struggle. Okay. I mean, across the many, many, many athletes I've worked with who have gone through injury, not a single one of them hasn't suffered in some regard. So again, you're not alone if you're experiencing this, and it's hard to cope with. So first and foremost, I really look at the injury recovery and rehabilitation process and moving into the return to sport or activity process as being one that while we can feel totally removed from the sport and that action, there are actual ways that we can, even in the rehabilitation exercises, use a variety of different tools to kind of help us. And so I'll just get into them. So, one thing that I really like to use, whether it's in injury recovery, rehabilitation, or just in general, sports and performance, is imagery. And just like I said, what do we have control over? Our mind. So, if we can learn to use imagery, that's a way that we can actually bring ourselves to a competitive environment or to the pitch or the court and be able to do our exercises or whatever we're doing by visualizing ourselves doing it practically in attachment with the sport. Okay. So let's say if we're doing like some bicep curls, right? And, it's a low weight and the athlete's not feeling like, oh, I'm not getting a lot here. Because a lot of athletes, right? If we're in a lower weight or we can't, actually add weight or, we're just doing flexion and flexibility things, it can feel like we're not doing much. So for in that example, let's say this is an Olympic curler or an Olympic weightlifter, right? And so they have to heal this injury. Okay, well then in this motion, if they're visualizing, can't you do that at a pace where you're imagining yourself doing a snatch? So there are ways that imagery can enable us to do the activities that we're doing, but imagine ourselves doing it practically related to the thing we love or in a space that we love doing it.
Love that. I never thought, we often tell people to visualize their muscles moving, like if you're doing a push-up, if you think about your scapula coming together, you're more likely to engage. But thinking about doing your sport, maybe I've never thought of that before. That's great.
Yeah. And I mean, even sometimes I talk to athletes who, may be doing really moderated activities. And it's even like imagining yourself at your favorite gym if you're doing a few push-ups, or like, I don't know, for a competition or things like that, right? So there are ways that we can kind of trick the mind to bring us to a place that brings kind of that emotionality down. Now, also, one of the biggest things is also doing sports specific skills. So this is where sometimes I say, get creative. And sure, okay, this might pull a little bit from your provider or your PT to kind of collaborate, because of course, always listen to your medical professional and advisement when doing things, because I have learned myself the hard way. Just listen, take your time, and it will be okay. So, one of the things that we can do is actually get creative to enable us to do the rehabilitation exercises that actually are more related to the sport. So, for example, basketball player recovering from ACL reconstruction can do passing drills. You could be sitting and you could do passing drills, right? If you're non-weight bearing, you could do free throws if you're standing, and that's not in your kinetics. Again, doctor approved. So there are ways that even if you're unable to weight bear or stand up, you can still do plenty of skills that are going to assist you when you return. So it's, again, with medical advisement, you can say, hey, what about doing this in a chair? Or if it's upper body, okay, well, can I spin while I'm at practice? And, that's my cardio or something like that. So also the other part about this is I really tend to like to recommend, when feasible, to do your rehabilitation with your team during the time that you would usually be at practice or running or engaging in the specific activity that you love. If you love nature and are a hiker, okay, bring some bands out to your favorite trail, find a flat spot and do it. So it's a lot of times when we're in that injury position, our mind is saying, I can't, I can't, I can't, I can't, I can't. But the reality is yes, we can. If we get creative, and if with consultation, again, we can find those ways to parallel it so that you're still connected and it still feels like you're doing something. For us athletes, we tend to be a bit structured. And so a lot of times, timing or scheduling in the rehab or doing things that you would normally do for your workout or sport will be helpful. It is in the small things. Now, a few other quick things, well, not quick, but things to think about, is that, like you said, or like we all say, sports actually a great way for socialization and connection. So it can, when we're injured, we can feel isolated. That's natural. So it's really important to stay connected with your social relationships through sports, whether that's going for a coffee, whether that's going to support your teammates or players at a race or somewhere, whether that's even going to the sport or game you love to play and watching with some of your peers who also enjoy the sport, or going to your local pub or restaurant, things like that. So maintaining that connection is really important. Again, like I just said, even though it might be hard, go to practice, go to games, stay connected, because in the end, that connection really does help. Also, take on a different role. See if there are other opportunities within your sport or activity that could be helpful. For those of us, right, the athlete, especially in team sports, can feel like they're letting their team down or they're not participating. And so the thing that we tend to forget as athletes is there are many other things that we can do. You can be stats person. You could be what's the word? Equipment manager. You could assist. You can, do a lot of different things that can really help during this process, keep you connected. So ask someone, ask if there are opportunities so that you feel like you're doing something. That's key. Again, like I talked about, ask your doctor about cross training or other forms of physical activity that can be done that are protective to the injury, but may give you that little extra Oh, I did something, achievement check. Also, I might be biased, but talk about how you're feeling. Okay. You're not alone. And it's, those of us who have suffered injury and are surrounded by folks who maybe have not or are not as passionate about sports, there can be this experience at times that they don't get it. They just don't get it. It's hard for me to not run. It's hard for me to not do this. Why don't they understand? So there's a lot of times there can be invalidation during this process. So, okay, if you're saying, I'm fine, I'm in a bit of pain, your partner, your child, your friend, your parent is not going to know that actually you're really struggling. So I know it's vulnerable. I know it's sometimes hard to talk about our feelings, but if we talk about it, that's another way to help with staying in it and accessing support and resources that could be helpful. And also increase the amount of time that you're taking for yourself. Self-care, another favorite buzzword of our time, and or just pleasurable activities. And so what I did was include this 8 dimensions of wellness wheel, which I tend to gravitate towards because there are other aspects when we think about self-care that we don't really recognize sometimes. We're kind of used to the social, the physical, the environmental, okay, taking care of our feelings, but there are also some other things that we can do. So, financial, okay, maybe this is the time where you set a goal that, hey, I want to hike X mountain. And so I'm going to save financially. So when I'm done with my recovery process and I'm cleared for activity, I can go do this hike. Right. So there are ways that we can pair this time with other ways of fulfillment. If it's intellectual, oh, when's the last time we read a book, listen to a podcast, go to, a talk about something we're interested in, right? There are many, many ways for us to take care of ourselves. And so just wanted to provide that as a reference for folks to think more broadly than just the walk, phone a friend, right? There are lots of things that we can do.
Yeah, I love that. I've never seen this 8 dimensions of wellness, but that's a really cool concept. And, you know, I say to some patients that are really struggling, like, might be an opportunity to try something new that you've never done before. And sometimes I get like groans, I can't do anything else. And we go through lists. I can't do this. I can't do this. I love taking it out of sport. So going to a talk or, thinking about other ways to work on yourself.
Exactly. Yeah. See that I can't. And in those moments too, what I tend to say is okay, if you've said I can't maybe 2 or 3 times to a few suggestions, pause. Why? Ask yourself, why can't you?
Hmm.
Is that hesitation because it's not what I want to do, because it's not my sport or the activity I love? Is it really a can't? And we'll get into that a little bit
Yeah, actually,
later, but I think that's something. Catch yourself when you say you can't, because a lot
right,
of times we
exactly.
can't
But
in
yeah,
moderation.
yep. Yep, I hear a lot of I can't. So that actually leads us into the next question, which is how do you deal with the negative self-talk and the sort of feeling like I'm never going to get better. This is going to be my problem for the rest of my life. And you just get stuck in that.
Oh, yes. Well, been there and been stuck in that thought many times. So I'm sharing a few that, I think could be really helpful. So I tend to reference that inner self-talk as our negative coach or just our inner coach. Our inner coach can sometimes be positive. Yeah, you got this. Great shot. Woo! Other times, not at all. It's the I can't, I'm never going to get there. And so, like I keep saying, our mind is the one thing that we can exert control when we feel like we don't have control over other things. So, one of my favorite tools is thought stopping. So, it's not kind of, it's the exact same idea as when you get a song stuck in your head. And we all know how annoying that is. So when you notice that a negative thought is beginning to cycle and it's, I can't, I'm never going to get better. First step is always recognition. So then say to yourself or do something physical that says, stop, acknowledge that the negative inner coach is tearing you down. And then what we do is we need to redirect. So how do we redirect? Do a distracting activity. Change your environment. Begin to think about something else. So just like when that annoying song is stuck in our head, it's the same idea. A lot of times, taking ourselves, recognizing the moment is happening, and then diverting is really, really effective. And it could be as simple as just getting up out of your chair, refilling your water, and going and sitting back down. So it's in the little things. Now, another way to challenge anxious, negative thoughts is actually challenging them directly. And there are two ways that we can do that. So it's the exact same idea. First step is recognition, okay? So when the anxious thought, the negative thought is coming up, okay, challenge it with the opposite. So Dr. Zhao brought up the perfect example for athletes in this situation. You're never going to play sports again. Frequent one, okay? Well, the challenge would be, yes, you are. You're dedicated to your rehab. You are making progress. You've achieved 50 degrees of flexion. You're 1 week away from being able to bear weight. So it's really just taking that negative thought that the inner coach is spitting at you and giving it all the data that says, you're wrong. Nope, not it. Now, another way that you can talk to your negative inner coach, I say, is just clap back at it, separate yourself from it. Okay, this is just my negative coach. You're not being rational right now. I'm executing my plan. I am prepared. So this is a little bit of a personalization and an externalization tool. It's taking the negative inner coach out. And just like you're talking to a person, argue. No, I know what you're doing here. I see that you're trying to tear me down, and I'm not going to stand for it. Now, another one that's really like, this is my favorite in a lot of ways because it's short, it's sweet, and it can be really helpful, both really in any realm of our life, honestly. And that's positive mantra and positive self-talk. Okay. So that's actually training our inner coach to stay positive. And I say training for a specific reason. All of these are skills. So just like you practice your free throws, just like you practice serves, just like you work on your splits and running, this just like any skill in athletic sports activity, all of these tools have to be practiced. Okay? Because you actually can change who this inner coach is. And just to get biological with it, the reality is that we can actually change the pathways of our thinking. And how do we do that? Repetition. So positive mantras and positive self-talks are just short, sweet comments that resonate with you, that pump you up. Nike really crushed it. Just do it, right? That's a positive mantra. I got this. I am strong. I am powerful. I am prepared. I am an athlete. I am capable, right? Blood, sweat, tears, although I don't subscribe to that as much, but y'all might have heard that in the past. But things like that can really help tame the inner coach.
Yeah. Wow. I love that. I'm going to give a little personal anecdote here. I started doing that every morning, probably the end of last year, listening to a positive affirmation before I even get out of bed. I listen to like a 5-minute, and then I write down the one that resonates with me like 5 times in a little book. And I mean, it's a lot of repetition, like you said. And then I put it on a sticky and I put it on my computer for the day. And so it's like, and then I have an app where it pops up on my phone. So that sounds, I sound a little,
I love it.
that's intense, but I totally subscribe to what you're saying. And does that mean you're never going to have a negative thought? No,
Mm-mm.
I have them all the time. But I have
Exactly.
something to go back to, something to anchor to. So thank you for saying that.
Absolutely. And that's actually one of my, if we were to take this one step further, that's actually one of my favorite confidence building tools and helping to train the negative inner coach. Because, so one thing that I really recommend to teen athletes, during that developmental stage, but this is really appropriate to anyone, especially when we're coping with injury, is if you stand in front of the mirror and you develop a stance that makes you feel strong, powerful, in control. And you establish this. So mine's kind of the superwoman kind of power stance. And so you better believe I did that before this presentation, right? So it's a way of just saying to yourself, I am ready, I am prepared, and it's grounding you. So it takes this positive self-talk, rehearsing it every morning in the mirror, right? Again, is another way to help with the mind body connection, because the mirror and a positive stance that makes you feel powerful paired with the positive thinking, again, is helping us build that connection, but also has the secondary benefits of positive self-esteem, confidence, self-worth. So thanks for bringing that up,
I'm
Dr.
going to add the mirror. I love that.
Oh, yeah. Oh, yeah. Because when do we really go to the mirror? It's not to say, wow, you look fabulous. It's usually to, check if your hair's out of place
Yeah.
or if the outfit matches. So we got to develop a better
Got
relationship
to
with the
reclaim
mirror.
the mirror time. I love that. And
Reclaim
I,
it.
I love what you said about pathways, because I think there's even studies showing that affirmations actually change pathways in your brain, which is
Yes.
real.
It's so real. Science says it. So, yes, the research is out there. It is.
Yeah. So now a lot of people we see have a chronic problem. It's been going on for a long time, and maybe they're starting to get better, but they have this fear around moving again. And a lot of what we're doing is trying to encourage them to give it a try, to start, to, not be so afraid. What are ways to cope with that feeling?
Excellent. So again, you're not alone. This is a natural part of the process. So when you get closer to that time where you're cleared to engage in activities, it's natural to be a little bit concerned. Now, the rationale for this is, some athletes actually do identify an injury as a traumatic event for them. And so, a lot of this is being able to just honor the intensity of what an injury can feel like and can be for someone. And so, part of what I wanted to just introduce us to is actually this idea of tip skills. Okay, so it's how to deal with intense emotion. So that fear, that high anxiety, or just that resistance that you feel. I wanted to give our community here a few things that we can try. And tip is a really good remembering tool. And again, this is with the mind-body connection. So what the tip skills do is actually trick the physiological response from the thoughts, feelings, and reactions to address the physiological reaction that's happening in the body to decrease the experience of the emotion. So, how do we do that? Well, one, we can change the temperature. Okay, and this is going back to evolutionary theory. Okay, so if the saber-toothed tiger is coming straight at us, okay, we're going to have a reaction that prepares us for fight, flight, or freeze. It's a survival response. So what happens is our body temperature increases, our heart rate increases, our muscles tighten, and we also have this experience of that needing to do something, right? That kind of activation, like, ugh. So what we do is we meet those physiological reactions with the opposite. So if our body temperature is rising, we got to cool it down. So how can we do that? So I always like to use coping tools that you can kind of do most places or have access to things. So one thing that you can do is you can just hold ice cubes. I know it sounds silly, but if our body temperature is increasing, then we're hot. Cool yourself down. Another way to do that: cold showers, ice baths. Another really great way is the cold face plunge. So you'll see the eye here in this image that says intense exercise. Okay, I'm skipping that because right now we're coping with injury. Okay, so I'm moving a little bit down. Just wanted to orient everyone. So with the cold face plunge, what you can do is you can fill a sink or a tub or a bowl with some cold water. If you're feeling really spicy, put some ice in it. Now what you do is you take a big deep breath and then you submerge your face in the water, holding your breath for 30 seconds. If this is challenging, then it's okay to come back up, take a little breath, and go back down. Now, what this does is it actually activates the diver's reflex in our body. I won't get into all the physiological things that this does, but what the impact of this will do is it actually decreases your heart rate by 35 to 45 beats per minute just in that 30 seconds. So folks have this experience of this, and it can be really, really helpful to reset when we're having intense emotions. Now, another tool, right? So if our muscles are tensing in this reaction, then we have to actually release and relax the muscles. And one way that you can do that is through progressive muscle relaxation. And what that is systematically tightening your muscles, holding it tight for 5 seconds, and then releasing it. And so generally speaking, you can do it in an area where you hold your most tension. For me, that's, my traps, my upper kind of area. So I'll do this throughout the day and release. And so again, it's exerting control over the automatic physiological response to then move from face down to the neck, shoulders, arms, abs. So kind of going top to bottom and tensing all those muscles and relaxing them. So that's another way. Now, one of my favorite tools of all time, because everyone's got to breathe, is actually using breathing techniques. So one of those techniques is the box breath, where you inhale for 4 seconds, you hold it for 4 seconds, you exhale for 4 seconds, and then you rest for 4 seconds. Another way is just an inhale for 4 and a big exhale for 8. So one reason why I recommend the box breathing is because it has that counting technique that can be an extra distraction tool if needed, if the thoughts are going. But really, the emphasis is on control of the exhale. The exhale is what downregulates. And so if you're just breathing with that big focus on the exhale, you'll take control over that increased heart rate and will decrease the intensity of the emotions. Now, 2 other techniques that can be really helpful: meditation. Now, I always have to go to the meditation route. I know this isn't for everyone, but there is a benefit to it. So one easy technique that I share around meditation for those folks who might not be super into it is sit comfortably, go to a quiet space, and then just pick a mental device. So that could be one of those positive mantras or a relaxation word. So for example, we can just use heal because we're talking about injury and recuperation. So as you just focus on your breath using one of those breathing techniques, work on clearing your mind. A lot easier said than done. Now, it might take you a while, and that's okay. But one of the things is that to slowly say to yourself, heal. Heal. And so helping with that mental device to focus the thoughts on something can really be helpful for decreasing the heightened experience. Okay. Now, the last thing that I'll say is that whenever we have any sense of fear or anxiety, the number one thing that that tells us is run, avoid, don't do it. But guess what? Avoidance is the thing that makes the fear and anxiety grow. It makes the thing become more fearful. So, like Dr. Zhao asked, right, what about when we're starting again to do more activity, to move in a way again that might bring up some of those intense feelings? Well, guess what you got to do? You got to do it, and you got to do it often. Okay. Not outside of your regiment, but really systematically throughout the day, doing the activity that brings up that feeling of intense emotion is going to teach you it is not the thing to be feared. And that takes some time and, of course, repetition, like I said. But at the end of the day, that's just fear talking. So talk back at those thoughts. I can move my knee. I know how to walk. I've walked for X amount of years. It's okay. I'm safe. I'm listening to my body, and I'm okay. And so using some of these techniques in conjunction with exposure can really help that process as well.
Oh, that's excellent. I can see us. I mean, this is going to help us coach our bodies too, or coach our patients too, just having these tools, because we just want to say, just do it is not worth it.
Exactly.
In the sake of time, I wanted to skip ahead and
Sure.
talk a little bit about motivational techniques for sticking with rehab. I know those exercises aren't always sexy or fun, but it's like your vitamins or it's the vegetables you need to get better. What can people do when they really don't want to do the exercises?
Oh, well, that's a very frequent experience. And so the thing that I always say is, okay, it's all right. I know it's not the thing that you're used to doing. I know you're not getting that input in the sweat and the same kind of experience as your sport or activity. But the number one thing that we can do, and what athletes are really good at doing, is let's set goals. There's no reason that we can't set goals for rehabilitation. And this is the number one thing that can really help with adherence, managing the negative inner coach, challenging those distorted thoughts, and also coping with the intense emotion, because it's exposure. So the SMART goal framework says we set specific, measurable, attainable, relevant, and time-bound goals. And the thing that I always emphasize is that one of the things that we frequently forget is that goals are set to be adapted. So a lot of times I say, get a baseline, work with your PT, medical, practitioner, your athletic trainer, whoever is overseeing your rehabilitation, and get a baseline. So when you start out, what is your degrees of extension or flexion? How much weight are you starting at? How many minutes? And so then working together to set goals that say, for example, I want to achieve 0 degrees of extension by Friday of this week, right? So we want to, again, it could be, I want in 1 month, I want to be able to bike for 10 minutes at 5 miles per hour, whatever it is. So by setting goals, it helps us to be able to track our progress, because during the rehabilitation process, it might be a degree, right? It might be being able to do 1 more squat. And for us athletes, that's not the goals we're used to achieving. So by setting these goals, by tracking them, by writing them down, it helps to stay connected, to know that what you're doing is working, and provide that positive reinforcement. Now, again, the last thing with positive reinforcement is celebrate those wins, celebrate the progress. Hey, when you can take that brace off, go get yourself a little sweet treat. Go get yourself, tickets to the movie you want to see. So don't be afraid to reward yourself along the way. I know it's not the same type of rewards you get from your sport or activity, but you deserve it. So treat yourself and develop a reinforcement schedule along the process so that you're celebrating those wins rather than, thinking about the I can'ts.
Love that. Oh, yes, we need to celebrate more.
Yes.
Um, how does someone know when it's time to see a professional like you?
Great question. So I wanted to outline a few common symptoms or changes or things that folks may see. And so I always tell people that the people in your life, you know when things are shifting. So, what are some common symptoms? Sadness, isolation, irritation, lack of motivation, anger, frustration, changes in appetite, sleep disturbance, disengagement, difficulty maintaining the rehabilitation schedule, lack of progress in treatment or healing, external or internal pressure to resume sport. Additionally, maybe further along the way, also we can look out about worry about returning to play, the time that it's taking in rehab, fear about their future, stress about not being able to exercise, lashing out, and also changes in eating or diet behaviors. So, these are some pretty, common symptoms when coping. And so if you just notice that yourself or someone else is struggling, you're not alone. And so, just in alongside with this, I also wanted to just share with the community different ways that they can access support. We're few but mighty out there. The world of sports and performance psychology is expanding, which is wonderful. But I wanted to make sure that folks know who they can contact if they're looking for someone. So, of course, your wonderful providers at Avid Sports Medicine can help happily, provide you with some resources. Of course, meeting you all today, don't be a stranger. Feel free. You can always outreach me and find additional information at Align Sports and Performance Psychology's website at alignbayarea.com. I am always happy to provide referrals or resources to folks in need, whether you are looking for private practice to support or something else. So please just don't be a stranger. Also, the Association for Applied Sports Psychology does have a list of providers in the area. So a provider directory that can be of help. Also, psychologytoday.com is a really good reference point, and you can also select whether you want to use insurance. They have selection for sports and performance providers. And so that's another really good reference for anywhere in the country as well. And then, good old fashioned Google search can always help. Sports providers, sports practitioners, mental skills and performance coaches, just some buzzwords that might help folks get connected.
Oh, thank you so much. I think we're going to need to have a part 2 and 3 of this. Much of it. I just want to open it up to anyone in the group who has any questions or comments. We have a few minutes left. I think so many of those things, even though we framed it about sport, are just about life and how we can deal with stress, anxiety, negative feelings, all the things, motivation in life. So I hope that, whatever people take away from this, I hope they know it applies to many situations, and we're going to share this widely so that our community can benefit.
Excellent. And I see a chat question here. Oh, you're very, very welcome. Thank you for attending. And like Dr. Zhao said about the slides, there will be a recording, I believe, correct? So for reference, please feel free to go back and snapshot, but all of that information will be up there.
Yeah, thank you so much. I know you have a busy packed schedule. So with that, we'll let you go, and you know, don't, you're not a stranger. You can find her also on the Avid website. If you're struggling at all, please reach out. Like Dr. Lowe said, we're in this together. You're not alone.
Exactly. Well, thank you so much, Dr. Zhao. Thank you, Avid community. It's a pleasure to be here with you today. And yeah, take good care. And remember, you can do anything you set your mind to. So stay well and all the best.
Bye-bye.
Bye.